Hello, everyone. My name is Kaitala Kimbretra. Uh, I'm doing a course of Introduction to Grand Challenges and Great Opportunities. Today, I want to take you on a journey into a pressing challenge, which is health inequality in rural Rwanda. Uh, Imagine needing a medical attention, but the nearest hospital is hours away. There's no ambulance, and the doctors are few and far between. This is the daily reality for millions of people living in Rwanda's rural districts. In this presentation, we will explore who is mostly affected, why this inequality exists, the factors contributing to it, and what solutions can transform healthcare for rural communities. By the end of this presentation, you will see why this issue is not just a health problem, it is, but it's a national development challenge. Uh, as my next slide, I'll start with where there is limited access to healthcare in rural Rwanda. Many rural areas lack hospitals, ambulances, and essential medical equipments. People often travel long distances the to reach the medical care facilities, and there is shortage of doctors. Even those who reach a facility may not get timely treatment, or the treatment is not accessible at the right time. The result in preventable deaths, weak maternal health, delayed diseases, detection rates. This is the result of limited access in those rural areas, preventable deaths, weak maternal health, and delayed disease detection. Imagine a mother giving birth without a trained professional nearby. That's a great challenge. And also, or a sick child too far from care. A sick child who is not being taken care of as it should be or effectively. This happens every day in rural areas, which is a great loss to the community. Next, I'm going to talk about significances and populations affected. Pregnant women under Pregnant women, children under 5, and the elderly are most affected. Remote districts like Nyamasheke, Karongi, Ngororero, Gisagara face the worst challenges. This matters because poor health reduces national productivity, increases maternal and child mortality, and slows progress toward universal health coverage. When rural communities are left behind, the whole nation feels the impact. Next, I'm going to talk about the linked GCGOs. This problem connects to several GCGOs. In health, low health literacy delays care seeking. No, sorry. In health, poor access increase disease burden. In education, low health literacy delays care seeking. In infrastructure, missing hospitals, ambulances, and poor roads make access to the medical care facilities. Technology and innovation offer hope. Digital and telemedicine can connect remote patients with doctors, bridging the gap. That's the linked GCGOs. I'm going to the problem analysis, which is demand, capacity, access, supply, and policy. The DCACSP framework helps us understand the causes. First thing, I'll go to the demand. Low health literacy and inability to afford transport. Capacity, shortage of trained personnel and medical equipment. Access, long distances and poor roads. Supply, too few facilities. policy, limited insurance coverage in remote areas. Together, these factors create a cycle of poor health outcomes in rural Rwanda. There's a context whereby 83% of Rwandans live in rural areas, only one doctor per 10,000 people in many districts. That's a great shame. Great shame. Um, Next slide. I'm going to talk about these proposed solutions and interventions. Uh, there is fasting fast. Solutions include short-term and long-term measures. We'll start with the short-term. Mobile mobile clinics, telemedicine through community health workers, health education, and wider mutual dissenting. Whereby there will be deploying of mobile clinics, expanding telemedicine through community health workers, enhancing community health education. This short-term measure can at least reduce the rate of limited access to healthcare facilities or healthcare to the rural areas. Long-term measure, there is construction or renovation of rural health centers, providing incentives for doctors in remote areas, improving roads, and strengthen digital health systems. Uh, these two combined, this intervention can transform healthcare access sustainability in the rural areas in Rwanda. Next, I'll talk about the future outlook. In the future outlook, we'll start with if no action is taken, infant and maternal mortality will stay high and disease burdens will rise and rural urban inequality will grow. But with proper interventions, Rwanda can build a fairer health system, improve life expectancy, and reduce poverty linked to poor health. Um, Rural communities would finally have an equal chance at at a good health, a true national development opportunity. This, as you see, the first thing here, if no action is taken, these are the things that may result into no high infant and mortality rate, higher disease burden, expanding rural urban inequality. If correct measures are implemented, there will be better, fair health systems, improved life expectancy, development of increased development of universal healthcare SDG 3, less poverty as a result of improved health. Um, Next, as I conclude, these are the sources that the analysis and context and proposed intervention are grounded in evidence based on research. Thank you for listening. I hope this presentation has given you a clear understanding of health inequality in Rwanda and the possibilities for change. Thank you very much.